Good afternoon, everyone. We're just about ready to get started. My name is Trish Marcus, and I'm a health law partner in the Raleigh, North Carolina office of Nelson Mullins. I'd like to welcome all of you to the third annual Nelson Mullins Value-Based Care Conference. Whether you're attending here in person or online, we're delighted that you decided to participate in this important event. This year's conference is entitled Evolving Value-Based Strategies, and we have in store for you a thought-provoking keynote session followed by 4 panel sessions that will explore some of these strategies. According to a recent Commonwealth Fund report, although the U.S. spends enormous amounts of money on healthcare, a total of $4.8 trillion was spent in 2023, which amounts to $14,423 per person. The U.S. healthcare industry ranks last among 10 other high-income countries on key issues including access to care, health equity, and outcomes. Among Australia, Canada, France, Germany, the Netherlands, New Zealand, Sweden, Switzerland, and the UK, the U.S. ranked 10th overall in health system performance. This overall ranking was due to a 10th place ranking in access to care based on high out-of-pocket costs and the 26 million individuals who remain uninsured in this country, as well as a 9th place ranking in administrative efficiency based on the complexity of our insurance system. The U.S. also placed 9th in health equity due to disparities in access to care and reports of racial and ethnic discrimination, and we placed 10th in health outcomes. The U.S. has the highest rate of preventable deaths among these countries and a lower than average life expectancy due in part to the opioid epidemic and the prevalence of gun violence. When asked in a media briefing about how value-based care models could help address some of these U.S. healthcare system failings, Reginald D. Williams II, who's the vice president of the Commonwealth Fund, told the American Journal of Managed Care, "I think that's where the opportunity is, to think about the use of how technology can potentially support the care of the administrative efficiency around payments. Although technology certainly has been shown to help identify and eliminate duplicative or unnecessary care, I would add that technology is key to identifying ways to improve the quality and coordination of care, increase patients' engagement in their care, and reduce the cost of care without reducing quality for a given patient population, and then measuring the impact of the measures that are implemented to achieve these goals in any value-based effort." Following our keynote presentation, we're pleased to bring you 4 panel discussions addressing different facets of designing and implementing value-based strategies. These interdisciplinary conversations will explore the use of value-based enterprises to integrate primary and specialist care, discuss the future of ACOs and value-based care, including Medicare Advantage, outline different entrepreneurial opportunities in value-based care, and, speaking of technology, address how AI intersects with and supports value-based care initiatives. Although Tom Moran, who is co-leader of Nelson Mullins Healthcare Group, will provide a more fulsome introduction to the sponsors of this program during our afternoon break, I would like to welcome and extend our collective thanks to the companies who generously sponsored this program. They include Pinnacle Healthcare Consulting, Enlace Health, Coker Group, Helgerson Solutions Group, and Buckhead FMV. Please join me in thanking each of these companies for their support today. I'd also like to recognize and thank Ed White and Mike Siegel, 2 Nelson Mullins partners who lead our firm's value-based care group and served as the co-chairs of this conference's planning committee. They've expended a significant amount of time and effort thinking about how to best share developments in this space with our colleagues, clients, and friends. And I believe their efforts will culminate in an outstanding afternoon of discussion and learning. Before I introduce our keynote speaker, I have just a few housekeeping items to share with you. So the first one, restrooms are located, and I have a blank because I thought I would figure out where they are, but I haven't. So Bob Wilson is saying they're that way. I guess you go out and then around. Okay. Although we have a scheduled break between 3 and 3:20, please take advantage of the facilities if and when you need them. As I mentioned earlier, this conference is also being live streamed to a virtual audience. Thank you to those who are joining us virtually. We hope that you'll participate in the conference by noting any questions or comments you have for the panelists in the chat box. For virtual attendees who desire to receive CLE credit for your attendance, please listen for the 2 code words that will be shared during the program, because you'll need to use those words during the post-conference survey to receive CLE credit. We'll try to leave about 10 minutes at the end of each panel for Q&A. However, if we run out of time during a session, please feel free to ask questions of the panelists during the break or the cocktail hour, or try connecting with them by email or phone after the conference. It is now my pleasure to introduce this year's keynote speaker, Jason Helgerson, who is the founder and Chief Solutions Officer of Helgerson Solutions Group. Jason founded Helgerson Solutions Group and serves as its Chief Executive Officer, leading the firm's mission of making the world a better place. An eternal optimist, Jason believes in new, innovative approaches to solving complex problems in health and social care. Jason also leads the firm's portfolio of venture capital and private equity advising, as well as engaging in international comparative work, bringing the best ideas to change makers across the globe. Most recently, Jason was New York State's Medicaid Director, a role he held for more than 7 years. New York's Medicaid program provides healthcare services to more than 6.6 million New Yorkers and has an annual budget in excess of $68 billion. Jason also served as Executive Director for New York's Medicaid Redesign Team, or MRT, directing New York Governor Andrew Cuomo's efforts to fundamentally reshape the state's Medicaid program to lower costs and improve healthcare quality. The MRT was recognized as a 2015 Innovation in American Government finalist by the Harvard Kennedy School of Government. In 2015, Jason was also recognized as a Public Official of the Year by Governing Magazine. Please join me in offering a warm welcome to Jason Helgerson.